Sex-based differences associated with mouthguard use and symptoms. So the thought was we're going to look at the difference between mouthguard use between sexes, but also how it impacts post-concussion symptom severity and recovery. So what they did is in the emergency department, they asked parents and patients to report their injury characteristics, what type of equipment they were wearing, yada, 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 yada. And then they followed up with them with symptom inventories at 1 month or at 1 week, 2 weeks, 4 weeks following that visit to try and see, how they recovered, etc. Overall, 42-ish% of participants reported wearing a mouthguard at the time of concussion. Highest proportion was in rugby and football and hockey. Mouthguard use is more common among males, and I'm just guessing because this is typically males playing things like football where females don't play that sport. Mouthguard use was not a strong contributor to concussion symptoms. So wearing a mouthguard did not reduce the symptom severity that people were experiencing. Sex and time following concussion were independently and significantly associated with symptoms. So basically, the longer it went on, the less symptoms you had. At the emergency department, week 1, week 2, and week 4 follow-up, there was no difference in symptom scores between those who did and did not wear a mouthguard. So mouthguard use does not protect against concussion symptoms within the first month. So basically what they're saying here is that wearing a mouthguard does not create less severe concussions. The symptoms are going to be the same. The severity is going to be the same. The recovery is going to be the same.